Okay, let's go ahead and get started. So, hi everybody. I'm Nick Galrakis, Executive Director of the Stephen G. Cancer Foundation and Elephants in Tea, and we are delighted to be bringing back and launching forward our community conversation series here in 2022. And today's topic is AYA cancer and the impacts of the pandemic. The Community Conversation series is a Stephen G. Cancer Foundation Elephants in Tea new digital series. These events are designed to engage our audiences on informative topics, research studies, and programs that are beneficial to the AYA cancer community. This series will be recorded, so anyone you know that wasn't able to attend today, we will have it on demand on our website for people to view. So today's a community conversation, as I mentioned, is on AYA cancer and the impact of the pandemic. And our two outstanding presenters today are Marlyn Allicock, Assistant Professor of Department of Health Promotion and Behavioral Sciences at UTHealth School of Public Health in Dallas, and Aubree Shea, Assistant Professor, Department of Health Promotion and Behavioral Sciences, also at UT School of Health in San Antonio. So with that, I am going to go ahead and pass it over to Aubree and Marlyn to take it from here.
Thank you very much. I'm going to try to share my screen the right way. I think it went.
Great, fantastic. Thank you all for being here. We're excited and grateful to be part of these community conversations so that Dr. Shea and I can share work that we've done with AYA cancer patients and survivors to think about the impact of the pandemic. So just to kind of set the stage for what we're going to do today, we'd like to talk a little bit about why we're interested in pursuing this topic, how we did this work primarily using a qualitative approach. And then Dr. Shea will share our results and some of the implications of our findings. What we hope is that we can have a really robust discussion to get your reactions and your reflections about the implications for healthcare and management and what this means for AYAs. And at the end, we'd like to tell you a little bit about our next steps for continuing this line of inquiry about the impact of the pandemic and how you might get involved if you'd like to. So this is a paper of the work we're wanting to discuss today. And if any of you want to get more information about the paper or would like a copy, we'll have our information at the end of this presentation, so you can contact us. So we followed the National Cancer Institute's definition of a cancer survivor. We included all AYAs, those who are age 18 to 39, with a history of a cancer diagnosis, regardless of the time from when they were diagnosed or their treatment status. And because we were doing this work primarily conducting it focus groups online, we chose only to have legal consenting adults, and we excluded those who were a little bit younger because we thought, for one, they may not be making their own healthcare decisions, and certainly considering social distancing rules and protocols, they may not even be making those either. So we know that individuals in this young adult age group, this is a period that's marked by a lot of transition, transition to maybe a new job, new location for school, entering college or higher education. They're also highly connected to their peers for social support. And most people at that age are working towards independence from their parents, and where they're developing their own identity and they're thinking about their own role and purpose for life. And for many, some of them might actually be starting their own families. So now we add cancer to that, right? Where cancer comes along and then there's disruptions from schools or jobs that they may be in. Oftentimes it may mean that people have to relocate back home. Their friendship network may start to get fragmented at that time, where they're not as supportive, or it starts out being very supportive and that sort of dwindles over the diagnosis and treatment. Or they may start feeling like a burden to others. So it threatens a lot of these social networks. And also the plans that folks have may actually either be stalled or altered in some ways at that time when cancer is added. And then just for fun, we just throw in this global pandemic, right? So it's not just that it was just a local thing by state that was happening. This whole world had been shut down at that point, where we're all experiencing protocols around social distancing, those social networks that we may have developed. Now we don't have the ability to travel and see those friends. We're in the support systems we have. We're actually separated from those support systems. And then here, the medical community was also scrambling to figure out how to continue care. So there was lots of delays, shutdowns, and more importantly, thinking about COVID-19, a lot at that time, lack of information regarding risk to this population. So we were really interested in this intersection of being a young adult, having cancer, and then with a pandemic, a global pandemic. So, and this is a period where we know is marked by so much uncertainty. And so we really wanted to explore that. So we did this work in June of 2020. So this was like 3 months into the pandemic where, you know, everybody was getting used to this new reality. You know, we're much further out. So I think our perspectives are a little different now, but trying to think back to that time, if you can, when it was very early in the pandemic where so much unknowns was happening. So our guiding questions were, we wanted to know what were the experiences of those young adult survivors and patients at that time, you know, to what degree, if at all, you know, medical care had been impacted. You know, what did they find was challenging for them? And what did they see as most helpful during this time? So how do we reach survivors during this pandemic? You know, everybody's away, they're at home, and we really needed a community partner. So really a big shout out to Elephants and Tea for really serving as a community academic partner for us in this work and helping us to send out our flyers and survey links to your own listserv. We also did it to a couple of our listservs to recruit survivors and patients. So we did this work all by Webex because we were all stuck at home, nowhere to go. And this platform was highly convenient because it reduced a lot of the logistics of traveling and parking and coming to a new facility, all of the problems we have with traditional focus groups. But more so, I think it really allowed participants to use other features of a WebEx platform, such as the chat, so they can actually privately communicate and respond to questions that they may not have felt comfortable or ran out of time or thought, you know, not a thought process, so they can add to that. If they didn't want to use their cameras, they could feel comfortable to turn their cameras off. At that point, we're starting that Zoom burnout. We're just getting into that phase 2. But more importantly, I think it really created a forum for them to be seen and heard and to connect with others who had similar histories and really to provide really valuable insight about their experiences. So these groups lasted about almost an hour, and we provided a $40 gift card once the focus group was completed as a thank you. So we use a thematic approach to analyze the focus group data. And that's just a way of us saying that we really use a very robust process to analyze our findings to ensure that they are what we are presenting today. So these were all recorded on WebEx, and then we got those professionally transcribed. I know I mentioned that people were able to write in the chat, and because of the timestamps, we were able to include those comments also in the transcript. So we get a full view of the data. And then our team really immersed ourselves in familiarizing ourselves with the data, where we were able to look at the data for patterns and meanings, look for similarities in words and ideas and topics so that we can make sense of this content. And this approach is really useful and appropriate when we're trying to find out something about people's own experiences and views. Okay. So in our recruitment information we sent out, it included a link for participants to indicate what was their preferred times for the online focus groups. So what we also did was to include a link so that they can complete a brief survey on REDCap. And that survey asks things about demographics, as we wanted to know who those people were, age, race, employment. We asked about cancer type, whether they had any other comorbidities, whether they had been diagnosed with COVID, they were caring for somebody with COVID. We also asked about how were they communicating with their healthcare team, and we had a couple of things on quality of life measures. So from that initial recruitment strategy, we had 39 adults who completed our online survey and consented to be part of the study. Of those, 24 participated in the 6 focus groups. So the other 15 or so didn't participate because, you know, there was a conflict of time or they didn't respond or something like that. So what I wanted to point out to you, who are those 24 people? So there were mostly women. Most were single. This was a fairly highly educated population. And most of, about half were working. But what I really wanted to point out to you is that the majority of participants were white. We do know that this is a limitation in our study, that we did not have a racial and ethnic diversity in our sample, because we know that African Americans and Latinos are disproportionately impacted in a negative way from COVID and the ensuing pandemic. So we hope our future attempts will take care of that. And we'll probably at the end talk a little bit about how maybe you can help us sort of recruit from that group. So that's who we had. And so I want to shift gears and turn it over to Dr. Shea so she can talk about what we learned from our focus group.
Thank you very much. Hi, everybody, and thank you so much for being here. We're excited to share this work. It's been something that's been a project for us that we've been really, really excited about. So we're excited to share the work back. So what I'm going to share then is the results. So what we heard from young adult survivors. First, as Dr. Allicock said, we had a survey, a brief survey that people filled out. And one of the questions that we found interesting was that we asked people in what ways they had been impacted by COVID-19. And remember that this again was in June 2020. So everything I'm going to say about the results, I'm going to keep reminding you that it's June 2020. So we know these things will have changed, and that's why we want to continue with this process. And we'll talk about that in a minute. But what we found here was that almost everybody was anxious about their health or their family's health, very understandably. Remember, this is also pre-vaccine, and people were just starting to wear masks all the time. Remember, for several months, we were just staying inside. But people were, more than half of the people felt isolated. Many people were worried about job security. And then there were feelings of worrying about their health through being less physically active or not sleeping as well, and job changes and impacts. And so what we took away from this is, first, that there's a lot of variety, right? That there's a lot of variation. Some people were impacted in different ways. There's not just one kind of set of things that happened to everybody, but that everybody was impacted by COVID-19, which of course we expected. So when we do our thematic analysis, we look for themes in the data. And these are the patterns that we were seeing that Dr. Allicock was talking about. And so these were the 4 main themes that we talked about. I'm going to go through these first 3 especially, and some of the sub-themes as well. And as I go, I'm going to share a few quotes from you from young adults that were in our group. So first, one of the things we noticed, some of the things we asked about were how people were responding to the pandemic. What were they doing? Were they, young adults are risk takers by nature, many of us, I don't really count anymore. I turned 40 this year, but I still like to say us. Anyway, but on the other hand, this was a really, we wanted to know what people were doing. And what we found is that most people were talking about being very cautious and practicing social distance and masking, and doing so probably more so than any of their peers and even their family. People talked about feeling like the bad guy because of that. And I'll give you a quote about that. And that it was hard to know what to do because there was lots of unknowns about were cancer survivors and AWAs, cancer survivors in particular, more at higher risk for COVID effects or for COVID infection. We just didn't know these things at that time. One survivor told us, I had really good friends that got married in May. And so I kind of had this internal conflict back and forth. The wedding still happened and I wanted to go. So there's just all these situations like that where I feel like I've been having a lot of internal battle with what's the right thing to do. So just all this uncertainty about how to do things. And they may have seen their peers making one decision and felt like they had to make a different decision. Another survivor was talking about this bad guy feeling, which we heard many, many times. They said, I'm definitely seen as the bad guy in my family because I don't agree to birthday parties. I won't agree to taking my mask off. I won't go into people's houses. I won't let my child go into people's houses. I won't let people visit. And we saw that this just layered on. It's already hard enough to have to make these decisions, but then to feel like you're the bad guy among your family, your loved ones, makes it even harder. So we also thought about, so many of those things that we just talked about, there was some components of that was specific to the history of cancer, but we found that there were some other kind of added additional burdens that everybody, or that people were discussing here. So first, anxiety about delayed medical care. So many people had delays in medical care. Sometimes it was delays in annual screenings or things like that, and thinking through that because they don't want to go in necessarily because it seems stressful to go in and maybe expose yourself, but also decisions about whether to put off screening. And this is what one of the participants said. I think that at least what I've experienced in the hospitals, I know they're stressed and they're losing out on all this money. And so it kind of seems like they're scheduling things for people by default. And when you even bring it up, like, is it safe? I'm worried about it. And they'll admit that it's not really safe, that you should probably just reschedule, but they're scheduling everybody, even though it's not safe necessarily. And so that's really not reassuring. So there was this time when the health system was coming back up, right? First, everything closed down for a while, then things were opening back up and people were having this distrust in the system because they were seeing, it felt like it was about the bottom line for the healthcare industry, sometimes at their expense. And so there was really hard to think about that. We especially saw people talk about the impact of clinical trials stalling or closing early on. One participant told us, I've exhausted most of my baseline courses of treatment, so clinical trials are essential for me. And when you hear like, oh, there's this one that you're an ideal fit for, you fit all the inclusion criteria, there's no exclusion criteria bumping you out. This one looks like a perfect fit for you, but you can't do anything about it because we're on hold and we don't know when it's going to get off hold. That's a bit nerve-wracking. Another area in the added burden of cancer were mental health stressors, especially around feelings of isolation, anxiety. One survivor described it really well. They said, it's increased my anxiety quite a bit. It's made me really scared to go out in public because I don't look actively ill. So people don't think I have any kind of issues with my health. So I don't outwardly appear to have any kind of illness, which I think makes people think that I'm overreacting. I think this is an important topic that we're going to see again later when we think towards the future, because now that this is my aside, not from our results here, but as we're thinking that people are starting to think about off-ramping, right, from our precautions. But what does that mean for people who may have be immune compromised, but don't look, you can't tell they look sick from the outside. And so we really want to help think about those things as well as we move on. So again, our biggest takeaway from this really was around this idea of compounding uncertainty. Survivors talked to us about this lack of a timeline, not knowing when this is going to end. They didn't know what their risks were, and then that made it so hard to weigh risk decisions about treatment and screening. Several survivors brought this up in different focus groups about this contrast between cancer treatment when there's a roadmap, right? It's super scary. Your whole world just turned right upside down, but someone does generally hand you kind of a roadmap of what's going to happen, and you know generally when the next time you're going to have a scan and what's going to happen. In contrast, here it was hard to see that. So They said, when I was in treatment, I knew I was going to have 8 treatments. It was going to take 6 months. I knew it would be hopefully done at the end of that. But with this, they said 2 weeks, and here we are 4 months later. Here we are 2 years later. And so there's not really a solid end. And the feeling of not knowing when you're going to be able to, or if you're going to be able to return to anything you used to do has been very unsettling and very hard. And then others talked about this idea that I brought up a little bit earlier about when clinics open back up and they're making decisions about, do I go and possibly expose myself in a clinic setting, or do I skip my scans and worry about recurrence more? So every day is kind of weighing my options. What's worse, getting a recurrence or getting COVID? One of the things that was unexpected for us, it makes a lot of sense, but we weren't really expecting survivors to talk so much about this, but about how they felt because of their experience with cancer treatment and survivorship, that they had coping strategies from their treatment time that they could rely on. They understood what isolation looks like and how to cope through that. They understood about just fear of illness in ways that other people didn't, and they had those strategies. So one sort of young adult told us, I feel like I kind of reverted back to my old coping mechanisms for when I was immunocompromised and I had to stay home. I literally still have all the old coloring books and everything that I used to have from then. And I was just doing them again because I don't know what else to do. And I was like, well, it worked then, so it might work now. That was a kind of simple example, but others talked about even already having prescriptions for anxiety because they had gotten them during their cancer treatment and they needed them now, and they felt like they were even maybe a step ahead of some of their peers who had no idea how to navigate mental health care, things like that. And then we saw people talking about a lot of resilience. One said, I feel like I have an advantage to some aspect to the mental game we're playing because I know what it's like. So I noticed when this all started, people were like, oh my gosh, we need masks. Oh my gosh, like you guys are all freaking out. And I've been doing this for 4 years. I'm going to put a mask on and go to the store, chill out. And I feel like people are starting to understand what it's like to not have a certain future. And they also felt like going on there that people were like understanding them finally. Oh, wow, this is legit. This is scary. And we heard that many times, those kinds of sentiments. So those were some of the main themes we had. Before we talk about takeaways from this, I want to make sure we address limitations. First, like Dr. Allicock said, we had a very white sample, a pretty highly educated sample. And so we're really committed in our future work to making sure we get more diversity, because we know that it matters, and that the coping strategies, the difficulties, the challenges, they may be different, and we want to make sure that we're capturing all of that. Also, our results, everything we've shared here is limited to that early stage of the pandemic, and we think much of it will be the same, but that's really what we're hoping that we can talk to you guys about at the end, is any ways you think some of these things may have changed or any reflections you have, and we'll talk about that in just a second. So some of the takeaways, we grouped this into kind of 3 things of things we would love for you to take away. For young adults, we're just wanting to acknowledge and see you with this compounding uncertainty that on top of cancer, which is always there and always kind of leading to some uncertainty about the future, the pandemic on top of that was a lot, and weighing those risk decisions and medical decisions was a lot. And I hope that people take away just the feeling that other people are feeling this way too, and it's very legitimate. We also just heard a lot about the need for connection and psychosocial supports, and how those were kind of threatened at the beginning, but also people were finding ways to do that. And one of the things I didn't talk about here, but we did hear, was that one of the kind of hidden benefits, or I don't know if that's the right word, of the pandemic was that when things went virtual, it did sometimes open up access to like AYA support groups to people who lived further away and couldn't make it back to their treatment center and things like that. So there were some opportunities for connection. And we were just really excited to see people talk about drawing on their experiences and strategies and really that resilience. For friends and family, we would hope that what they would take away from this is, and caregivers and loved ones, that that this is really tough, and that there's this increased uncertainty and weighing of risk going on all the time. It's well beyond, I think we all now can understand that. Those of us who don't have a history of cancer, we can understand the weighing of health risks in a whole new way now, but that is compounding when you have the history of cancer. And then finally, thinking through, is there any way you can support your young adult loved one so that they're not always the bad guy in these situations? And I just think that would be such a help to them. And then finally, for the medical community, a couple of things we've thought about from this and kind of next steps we're taking too is survivors talk to us a lot about how telehealth was super helpful to them as young adults because they have kids at home and they could see their doctor without having to worry about childcare, and or they don't live in their same city as their treatment community anymore. But at the same time, they talked about it really causing a lot of anxiety for certain things. One person talked about having like a bump in their scar, their surgery scar, and not having the doctor's hands there to be able to feel that and reassure them, that they just having to describe it online was really stress invoking. So one of the things we've thought about is the need for best practices around telehealth in this group and training for how to do that well, and also knowing when it's appropriate. Another big theme we were seeing is that at the beginning, when things started shutting down, and we all know that in our world with our climate and other things, we're not at the end of crises, right? There will be other crises in our lives. And that people need more psychosocial support and not less. So if hospitals are having to shut down and decide which services to provide, shutting down psychosocial support is not acceptable. People need more in that time. And then finally, we really need specialized information for AYAs about their risks and how the research applies to them. We're all kind of trying to digest a lot of health information these days. But how is it specific to AYAs and making sure that's readily available to them as well? Okay, so now we've talked for quite a while. We would love to hear back from you about any thoughts or reflections you have about this, questions, anything you think we got wrong, that we got right. We'd love to hear from you about that. And we have some specific questions to ask as well, but I thought I would start with just seeing if anyone had questions. You can feel free to use the chat, but you can also, we'd love to hear from you. So if you want to just unmute and talk and say your question or your thought out loud, that'd be wonderful too.
Hi, my name is Amanda Ferrero. I'm a patient advocate and also a 2-time AML leukemia survivor. What you said about cancer patients having the anxiety of like right after cancer, of people hearing the, oh, hey, you're cancer free, or, no disease detected, and then family and friends being like, okay, you're good, like life back to normal. And it's not, that doesn't stop. A lot of the time there's, post-treatment things that you need to deal with. And in my advocacy work, I work with LLS and the peer connection. I do a lot of advocacy, through family and friends and everything. But the biggest topic is feeling like you're completely left alone after that cancer free. Like once you say that to someone or announce it, it feels kind of like you're drained of all the support that you need. I feel like that is a huge area that we need to discuss and talk about. And I think so many patients, especially in the young adult community, can really benefit from that transition period of diagnosis, being with your doctor all the time, having that support, and then, you're cancer free, and then feeling like, okay, what do I do now? So thank you for discussing that. And I just, want to reiterate it. That's so important.
Thank you, Amanda. Really appreciate that. Yeah.
You're welcome.
Yeah. And I think we did hear that a lot from folks in our groups who were saying, my parents know that I'm cancer free, they just think I'm cancer free. So why am I worrying about this? They're older, they're doing whatever. So they think, well, if they're out, shopping or doing whatever, I could do that too, because I don't even look sick. And actually somebody said, you don't even look sick to me, right? So that is a shared concern for sure.
And I see in the chat that people are agreeing with you. 100%.
Yeah, thanks. I appreciate that. But like I said, I do a lot of work. I've even, I think, written a few articles for Elephants in Tea. Well, I'm a young adult. I deal with mostly young adults. But the mental health aspect of it, I usually say, when I try to explain to people, is that in the young adult, the 18 to 39, what happens in your life? So you're graduating high school, you're starting college, you're starting a family, you're starting a new career. Now, all those things normally is crazy. Now, add cancer on top of it. That's why I feel that diagnosis is life-changing, because, you're just starting to sprout and open your wings, and then they get cut. And then, you go through your diagnosis, but then afterwards, what happens? Like, you need to reevaluate everything and kind of start fresh all over again. So that's huge also, where there's so much anxiety and, PTSD of, okay, now is my life getting back on track? What's going to happen? Like, I don't have my doctors and everything that I can rely on. So now it's me dealing with all of the bills and the medication and, post-treatment doctor's appointments and starting my career. And then, sometimes I might get sick and, oh my God, PTSD, is the cancer coming back? It's such a hard time in someone's life. I'm still struggling with it now, even being a patient advocate. I think that it's the young adult cancer community. I feel, just that age range, that we need so much attention and love and care brought to that whole time. And I feel like when you're young and you go through cancer, you have your parents kind of with you, you're under their insurance, it's a little bit easier as a patient. And then when you're older, like your kids are grown and they could help you, and there's more foundations to help, and there's more, like senior care and programs. But when you're 18 to 39, it's, oh, you have energy, like the world is yours, go out and do it, and like everything's good. But wait a second, yeah. I have cancer, and then on top of housing and rent and kids and career and school, like there's so much. So in that, I'm sorry I'm talking so much. I'm so passionate about this age range and getting the help that people need. And I see it, there's so much need. There really, really is. And this post-pandemic, now we're like getting out of lockdowns and mask wearing and everything, but we need to keep the social interaction of Zoom calls, because people can't have, patients can't have family members be with them in the hospital. So what can they do? They can bring their cell phone and they can have it with them, and they can FaceTime and they can Zoom call. And that's one of the only things that, this device is the only way you can have a social interaction when you're in the hospital fighting for your life. We need
That's-
to keep that
yeah.
around.
Thank
Yeah.
you. Thank you for being so open with that.
Yeah.
Oh,
I
you're
think,
welcome.
to speak to your point about reintegration and dealing with all of those things, I think one of the things we did here had to do with folks, young adults who were saying, oh, I've started to reintegrate. So I've started my college career. I'm back and I'm doing this. And then here comes COVID. Whoosh. Now I have to make decisions. Do I ride a bus to go to school? Do I social distance in the classroom? Because my peers can do that, but can I, right? So that was also a very real thing. And I think what the other thing you're speaking to is how do we leverage technology as more to provide more support in these various aspects of, and how can research help us do that as a way to sort of connect the dots instead of when supports get fragmented, for sure.
Yeah, I totally agree. And Rachel, I see your question in the chat about suggestions for further research. Yeah, I don't think you missed it. We didn't really have a slide talking about that, but I'd love to talk about it. So this project, which was, felt like it was so fun to do because we were able to turn it around so quick and like really try to talk to people right in the moment. It was so nice. But from this data, we've actually got quite a lot of projects going. It's really clued us into several different things. So a couple of things we're doing are around telehealth. So we have a grant working with MD Anderson and their AYA clinic to think about what is appropriate visits for telehealth. To Amanda's point a minute ago, we want to take the things that were good in this, like the few gems we've had of the last 2 years, and make sure we keep those as we move on and hopefully move back to some things normal, but also take with us, for example, for me, not related to cancer, I don't want to go back to being in the office 5 days a week, right? I like working from home some. And so how can I take the gems that I found and move with them? And I think telehealth is one of those for AYAs, because we know that many AYAs struggle to come back for their visits or struggle to maintain healthcare because they're mobile. And so how do you keep a consistent relationship with your doctor if you've moved off for a new job or taken or moved, and started a family somewhere? And so we want to make sure though that it's high quality and actually good care. And so we're working to think about two aspects of that. What are the visits that are most appropriate for that? But also, what kind of training do physicians need? Like right now I'm struggling because I want to look at you, Rachel, because you asked this question. So I'm looking down here, but really my camera is up here, right? And so what are the best practices of how to talk to people and actually have patient-physician relationships and communication if we're going to do some of this virtually? So that's one area. Other that we didn't get to actually, so let me share my screen and I'll go to that and then I'll come back to some of the questions we had from y'all. I think it's this one. Let's see. Yeah. I'm going to skip ahead a couple slides. Is that we are going to continue on with this kind of a next iteration of this project that we've just described. So we want to understand going forward. Now we're 2 years into the pandemic. How are things changing? Are young adults weighing things differently than they used to about their need for social connection and their need to be safe? And so we're going to do more focus groups around this and the same kind of format as before. There'll be online focus groups so that we can get people across the nation. This QR code does work and it takes you to that. Takes you to the survey that we talked about earlier, and that's kind of where it talks you through the project. And if you click on it, then you're consenting to be part of that. It'll describe all that in there. But you can also reach out to us if you have questions, and here's the link too if you prefer to write it down for later. But we'd love to hear from any of you who are here who are young adults with experience of cancer. that's one way we're continuing as well. We actually also, from this work, and then a few other people joined us over the last 2 years at UTHealth who are really interested in AYA issues. We have a research lab that we've now we have 5 of us that collaborate together all the time on many projects. And so we're doing all kinds of research. If there are people out there that are really interested in research around AYAs, and it's all epidemiological or behavioral health kind of research, that's our areas, feel free to reach out to us. We'd love to make sure we're including your voice and that sort of thing.
So one other area, sorry, Aubree,
Oh,
that was talked about that we haven't addressed, but I think it's more for sort of medical community cancer care organizations to think about rapidly being able to provide information in a repository that is concise, tailored. I mean, we mentioned that early in the presentation, but this need, as so much information is coming and studies are happening, how do we quickly have a pipeline where young adults can go to and say, okay, this relates to me, how does it, and having those systems built in, those information systems built in. So that's something that was lacking, that we heard loud and clear. But we're not the people to do that necessarily. We contribute to some of the information gathering, but sort of the dissemination of what works, what doesn't work, and how can care systems have that and provide that to the folks who actually need it is missing.
any other specific questions? I can give you a couple questions we have for y'all to start a discussion if you're up for that. It's hard for me to see everybody, but let me go back. I'll introduce this. So we just wanted to know, both from AYAs that are in the audience, from young adults in the audience, but also from anybody else who's here who works with young adults or is in the medical community. What else would be helpful to think through in this next round that we haven't? We wanted to know if we missed anything here. So we ask about these specific areas. You saw me talk through this earlier. Are there other kind of, now that we're further into this, impacts that we should be tracking to see, like how much it's affecting people?
Dr. Shea, I have something just to throw out there, and maybe this was covered in some aspect, but I think dating, since a lot of people were single and not married, I think that that's something to potentially ask folks is how's that side of your life going due to the COVID pandemic and everything else? I think that's an important topic to reflect on.
That is a great point. We did not have that in there, and we can certainly ask about that.
I know we'll be also adding some questions around vaccines, what hesitancy, interest in risk about that, that's fantastic. Thank you.
Yeah, appreciate that.
So Liz in the chat says also that AYA issues don't just end. Once you turn to 40, it continues. So yeah.
I noticed that too. One thing we wanted to hear, and actually this is a question we thought of for young adults here, but also maybe healthcare workers who are seeing people struggle with these decisions. But one of the kind of driving questions for our next round is thinking about this is, how has your decision making changed, if at all, since early in the pandemic? How are you weighing risks of exposure or of COVID with the need for connection, with the need for dating, with the need for life to go on? How are you guys weighing those risks, if anyone is willing to share or wants to share from like a provider's perspective of what you're seeing generally?
I feel like there's a lot of anxiety around every decision. Like cancer, you have a weakened immune system. You have to be careful of getting sick and wearing masks and hand sanitizer and everything. But with the pandemic, I'm seeing a lot of young adult cancer, but also, like everyday healthy people just going to the food store maybe once a week instead of like whenever you feel like you need to. There's very strategic planning just so you can prepare, make sure you have the mask, make sure you have your hand sanitizer and your gloves, make sure that you have what you need with you so that you can go. There's a lot of mentally preparing for what you're going to do because there's so much uncertainty in the world. That's what I'm seeing a lot of, getting ready for doctor's appointments or, just pre-planning so that you can be aware of your surroundings, prepared for what could happen. And I feel like it's a very social anxiety right now.
Yeah, it's a big mental and emotional tax on that, right? That every decision requires all this preparation. Yeah, it's great. Thank you, Amanda.
Hi, this is Marissa Query from the University of Michigan. I'm a patient coordinator for the AYA program here, and I would just like to kind of piggyback off Amanda's comment. I think as a provider, we definitely have to weigh our risks with what we do outside of work. You are working with immunocompromised folks, and as the provider, you don't want to put them at any additional risk. So making sure that you're extra careful and safe and, planning your day, like Amanda said, around not just hopping in and out of Target just because you're bored, but when you have like a reason to go in there, is important for the provider side of things. And I think most people that I work with, fortunately, do think that way. And the social work interns that I work with are very cautious about what they're doing in their free time as well. And I think from the patient perspective of things, the folks that I work with every day definitely have like their core group of people. So maybe their parents or their caregivers or their partner that they see regularly. And then a lot of other people in their lives have to be virtually checked in with, whether that's FaceTime or a Zoom call. But a lot of the like college age kids that I work with get a little frustrated because their friends are out at schools not being very COVID mindful. And then that puts them at risk if they were to see them. So they have to opt out of certain opportunities. And we talk a lot about how frustrating that can be when you see people that you care and love about just kind of bypass the pandemic overall, which puts their relationship at jeopardy because then you can't see an immunocompromised person. So that's kind of the additional layer there.
That's a great point. Thank you, Marissa. Yeah, and I think that's builds on what we were talking about with the feeling like the bad guy. But I think you put it really eloquently about how it's not just that you're a bad guy, but then the next decision you make about whether or not to safely be with that person is based on what you've already seen them doing. And so it just keeps going. Yeah, I appreciate that. And I appreciate you bringing the perspective of that care providers are making these decisions too, because they know that they're working with patients who may be immunocompromised. And so I thank you for that, for your work in that way. Also, Christian, I see your comment and appreciate you sharing that too. I think missing checkups is a big way that people are impacted because, yeah, it's hard to decide what's the best thing to do.
So I just want to say one more thing. Sorry. I like my brain goes off and I feel like it's important. So with the social anxiety of dealing with this pandemic, that's why I feel the social interaction of having like your phone and doing telehealth is so important, because not only is it like convenient for the doctor, do a telehealth real quick, get it over and done with, but you're also putting aside that crippling anxiety of wearing a mask, hand sanitizer. Oh my God, I'm going into the hospital. Do all of these people have COVID? Every single person you look at who sneezes because they have an allergy, oh my God, I'm gonna get it. And then it's like, you know, your chest hurts, and then you're there for a doctor's appointment, but you're having a panic attack on top of it because you're like, oh, you know. So socially, having your phone, doing telehealth visits, yes, was great for the pandemic, but for the future could be great too.
Yeah.
You know, the PTSD of that after cancer, the post-treatment, everything, that telehealth would be good for that. I know I get still anxiety driving up to the hospital. I go for telehealth if I can, you know, it just helps with that anxiety. And I think, unfortunately, the pandemic happened, but to a positive side, we found something that, you know, if you don't need to go get tested and you could talk to your doctor through, you know, a conference, it's going to eliminate a lot of that, you know, post-traumatic stress and anxiety. And that's a benefit of, you know, having this new technology that's coming through for young cancer patients.
Yeah, I think that's so important. And Amanda, I appreciate that. And the other thing that I think has come around a little bit that we have to keep going with is the policy change to allow for some telehealth where it wasn't allowed to bill for certain things before. So there were structural barriers that have come down a little bit for COVID, and we can't let them get built back up. So I think there's a lot of advocacy work there too. That's really important. Anybody else wanted to share anything or ask us any questions about this? We really appreciate y'all being here.
And something I'd love for you all to talk about, if you, or think about, or help us think through. I think something we saw, people are at different stages, right? So some people are in treatment, some people are outside of treatment in various timelines, some people are waiting to get on a clinical trial. Folks were just about to finish treatment when the pandemic hit. So then there were different, like, now I get to go outside and, you know, sort of release my treatment protocols, but now I can't, right? So they're in a very different space where other people are like, I need this life-saving treatment, I can't get this. And then the folks in between in their treatment time points, outside of their treatment time points. It's so very varied in terms of the levels of anxiety and what was most important. So it might be helpful for us to think about, are there things that we should be considering asking people at those various time points? Are they different? You know, I see this thing about the PTSD issue. It doesn't end, it seems, right? So, and these are other situations that trigger those, but are they, when we think of these blocks, if we had to divide it up along a timeline, in treatment, waiting trial, outside of treatment, somewhere further down the line, are they important things or key concepts that we are missing or need to be like very strategic about understanding? And this could be from a provider perspective too.
All right, I'm going to talk. I feel like you guys are going to get sick of my voice. But again, you know, in the patient advocacy, having a connection with someone or something that makes you feel like you're understood and that someone has been through what you're going through or going to go through is definitely huge. So I would say, you're just diagnosed with cancer, have talked to people who are in that same bracket. They're just diagnosed with cancer. So what they're looking into, insurance companies, how to deal with that, how to talk to insurance companies, how to ask your doctor questions, how to advocate for yourself, having a peer-to-peer connection, finding a patient advocate, talking to your social worker, getting those pamphlets and brochures, the research that you feel like patients need to do in the beginning stage. Then it's starting treatment. Okay, so then starting treatment. What do you need during treatment? things, for the hospital, the way you're going to feel at home. Again, pamphlets and brochures of how you're going to feel. Advocacy groups, Zoom meetings, blogs that talk about what other people went through. So you have that connection. Then post-treatment, like your NED or cancer-free. How do you deal with that? So after, post-treatment scheduling, do I need, to have my colonoscopy done, go see a gynecologist, get a physical, have regular blood, all that stuff is post-treatment. So maybe someone who's in post-treatment or just recently finished with that, or, therapists or clinicians that can help with that directly part of time. And then you can do, like 1 year post or 2 years post-treatment and what you need from them, because we know that it doesn't just end. We know there's PTSD. We know there's lasting anxiety, especially in the AYA community. So having that blocked out.
I love that idea of the match between,
yeah, that way,
yeah.
When you're going through separate parts or wherever you're at, there you feel like what you're going through and your pain and your anxiety is matched with someone else who went through the same things, and you can talk about it and you can look up the same research and talk about that research or share something. And I think that bond is greater. And yeah. I just see that a lot with patients.
And real quick, if I can jump in, because I know we have a couple of minutes, and I see there's another question, Dr. Shea, in the chat. But just to let people know, our second community conversation is coming up in April 7th at 2 p.m. Eastern. I think a lot of things that Amanda is talking about, people should definitely attend. It's going to be with professional independent health and patient advocates, and Rachel Westlake, who's actually in attendance today, will be leading that panel. Our registration page is not up yet for that, so be on the lookout in the coming weeks for it. But just wanted to mention, I think that a lot of the comments that have come up today, the transition and things of that nature, I think are going to be really important for people to come and listen to that one in April. So, and this series of community conversation is going to be bi-monthly, so we'll have a new topic every other month. So I just wanted to throw that out there for everybody, knowing and respecting people's times. They have a couple minutes left.
Thank you, Nick.
So go ahead, Dr. Shea. Sorry with the other question.
Okay, I was just going to say, I did see that Nick Corsetti asked a question about financial impacts to AYAs. We heard a little bit. We actually thought we would hear much more. That was a little bit one of our surprises, is that especially earlier in the pandemic, when many people's workplaces were closed, we thought we would hear more about that, but people tend to talk more about the health and decision making. And but we do in our group kind of plan to continue to look at that. We always think about the many aspects of psychosocial care and just survivorship care for AYAs and what that looks like. And financial is definitely on there. We recognize that there's financial issues at that age, no matter what. And then on top of that, with cancer and health insurance issues and things. So I appreciate you bringing that up. We'll make sure we're continuing to look at that. And
we got a minute. Anyone else have any questions? Well, Dr. Shea and Dr. Allicock, anything else you want to close with today?
I will just put up our email addresses again here at the end, so you have them. If anybody has questions and wants to jot those down, Nick has them as well. You can always reach out to him if you want to get in touch with us. But we would really love to continue this conversation in whatever way. So if you have things, as knowing that there's a group of 5 of us doing research in specifically this area, AYA, cancer, and survivorship, if there's things you're passionate about, we want to hear about it. So please do reach out to us.
Thank you very much for your time and your attention. We appreciate it.
Yeah, thank you.
And the flyer too that was on the PowerPoint today, folks, we will email that to everybody along this one right here. We'll actually email the flyer to everyone that attended today and registered, along with a link to the recording for this in case you want to share this with anybody. So again, thank you so much, Drs. Shea and Allicock, for an awesome presentation and for all the research that you're doing too for the AYA community. We all greatly appreciate that. So again, folks, thank you again for coming today. Again, my email is just at nick@elephantsandtea. Rachel is also our director of content on today. Rachel Elephants and Tea, if you want to reach out to us any questions, and like Dr. Shea mentioned, we can facilitate those questions over to them if anything comes in. Otherwise, thanks everybody so much. Appreciate it. Enjoy the rest of your day, and we'll talk to y'all soon. See you in a couple months.